this facility will offer a range of therapies and stimulation for people who have Alzheimer's and dementia in Gibraltar. So this would include everything from reminiscence therapy, arts and crafts, cognitive computer therapy, snoozing in rooms, and even services such as occupational therapy, physiotherapy, speech and language therapy. And on a more recreational level, there's hairdressers and medical services such as the chiropodist and the memory clinic located upstairs. We have nursing staff so that everything that needs to be done can be at the center itself. It can be sort of a one-stop shop for people who have Alzheimer's and dementia. Things like bloods, chest x-rays, ECGs can all be done within the center so that the patients don't have to be taken by their relatives to the hospital, the primary care center, and back and forth to have these tests done. Everything should be done within the day center itself, and that way we can provide a continuous, seamless service for our patients.
We're in one of the many activity rooms at the moment. What is this space used, for example?
So basically this room is one of our arts and crafts room. We have two of these kind. This is the blue room and the green room, which are more for patients to do things with their hands or to create, to color in, and or just generally to do perhaps some maths calculations, just so that everything that is done should have a purpose. All of our activities are assessed and always made sure that they're constantly used as a therapeutic base so that they're stimulating the patients.
And how exactly does creativity benefit the patient?
So basically, it allows the patient to be able to engage, to create, to be stimulated, and to be in their social environment.
And what are some of the main challenges faced when caring for patients with Alzheimer's and dementia on a day-to-day basis?
So carers do have to be well trained when dealing with these patients, because there are the most obvious difficult part about caring for patients who have Alzheimer's and dementia is their behavioral symptoms, and so they have to be able to handle these symptoms in a way that is not aggressive, that is kind, and calms the patient down, allows them to sort of engage and go back to their the activity that they were doing, and not sort of distress them further.
You mentioned relatives and caregivers at home. Just how beneficial is it for them to have this service now available?
So this is one of the main key features of the day centre. So this is one of the key features of our day centre. We would love for people to be able to have that respite that they so much deserve, and for them to be able to care for their relatives for a longer period of time if they have this break in the day, where they can take their relatives to the centre and then do whatever they need to do for a few hours, and then when they come and pick them up, they'll have more to talk about, they'll be well rested, and we're hoping that this will allow institutionalization to be delayed and for patients to be able to live in the community for longer with their relatives in their homes as they should be.